Good afternoon, everybody. My name is Mrunal Sisodia. I'm one of the co-chairs of the National Network of Parent Carer Forums. It's my pleasure to welcome you today to the second substantive session in our virtual conference this year. And I'm really pleased that today we're going to be joined by Nagina and Olivia, who are from the NHS England Children and Young People's Community Services team. Now, this is a really new team, and it's and we're really lucky that Nagina and Olivia are here today and able to join us at such a formative stage of their work, which I think is testament to the fact that they're really keen to get the input of parent carer forums and parents and carers, young people with SEND, to really shape what they're doing and inform what they're doing. So that's fantastic. I just wanted to take a moment to give you a little bit of context around the session today, which is that this is around the recovery in children's community services. Now, we know that this has been possibly the biggest issue that's been raised with us by parent carer forums over the course of the last year, essentially translated into waiting lists and difficulties in seeing services such as speech and language therapy, mental health services, community paediatricians, etc. These are all things that you will all be very familiar with. And we've had really clear feedback from our membership and from our regional meetings and from the polling and surveys that we've done. This came up as the #1 issue in our business planning polling that we did at this time last year for this year. And as a result, we at the NNPCF have been raising this and talking to NHS England about what's happening and your lived experience over the course of the year. So we've raised it at things such as the Learning Disability and Autism Steering Group. We've taken it to the Children and Young People's Stakeholder Council. We've also brought it up at the board for the Children and Young People's Long-Term Plan implementation. In addition to that, we did a webinar about halfway through the last year with Lorraine Mulroney on this very topic. And I'm really pleased to say that today we've got, as I said, we've got Nagina and Olivia, who are part of the new team specifically looking at this, which I think is, again, credit to the fact that we have been listened to. And they're going to talk to us today a little bit about what's happening and how the NHS is responding to these issues. So, Nagina and Olivia, over to you.
Thank you very much. Good afternoon, everybody. Hopefully you can all hear me. My name is Nagina Javed. I work at NHS England. I'm the Assistant Director for Children's Community Services based within the organisation. I've been here for 10 years now. It's going to be my 10-year anniversary at NHS England in April. And I'm really pleased that you've allowed us to have this chat with you today. So I'll just give you a little bit of background on me, and then I'll pass on to Liv. So as well as obviously working full-time, I'm also a mother to 3 kids, and I understand some of the kind of concerns and issues we have around children's community services, around maternity services, around supporting children to be well and have the best start to life. So I feel like I'm here with both hats on, as a professional working in this field, as well as a mum to 3 young babies, a 3-year-old, a 5-year-old and a 7-year-old. But I'll pass on to Liv, and then I'll chat to you guys soon.
Hi everyone, thanks Nagina and Mrunal. So my name's Liv Passy. I'm the Children's Community Services Manager at NHS England. And just to give you some background about who I am, I started at NHS England about 5 months ago with Nagina. So as Mrunal mentioned, we're a really new team. So it's really exciting that we've got the opportunity to come and speak to you today. Before working at NHS England, I worked at an acute hospital in London, specifically on more operational kind of running of children's community services. And then before that, I trained as a children's nurse. So although this is kind of a new role for me at NHS England, I've kind of had a very kind of children's focus to my career so far. We've come today to do 3 things. So firstly, to share the data and intelligence that we've got about children's community services. to let you know what we've been doing so far over the past 5 months. And also it's really important to us to get your insights as lived experience experts on children's community services that we can use to shape our direction of travel for the team. So we're at the moment looking at what our priority is going to be over the next year. And it will be really useful to kind of get your thoughts and input onto that as well. So I'll explain this a little bit later, but just so you're not caught unaware, we're using a Menti board, which some of you might be familiar with and might have used at webinars previously. There's a website called menti.com, and we'll share this information in the chat box as well. And there'll be a code in the chat box, and it will allow you to participate when we ask for some discussion points. So just a little bit of a heads up that that's what we'll be using later on. And we'll also be talking through our findings. So anyone that is joining in kind of via the phone will be able to kind of hear what's coming up as well. And we'll share back round at the end of the session as well. So to kick us off, we wanted to ask you the question. So what words come to mind when you describe your experiences with children's community services? So I'm going to take down the screen that I'm sharing now and put up another one, which will populate a word cloud, which you'll be able to see kind of live. So if you just bear with me 1 second, I'm just going to change the screens. So as I mentioned, if you go to www.menti.com and use the code 88910141, you'll be able to let us know what comes to mind when you describe your experiences with children's community services. And we've had an entry already, which is great to see.
I've put the code in the chat as well. Hopefully that's helpful. Yeah, we're seeing more people coming up. So we're just going to allow people the chance to kind of say what they need to do. So far we're seeing stretched, unclear pathways, probably lack of a capacity. Is that lack of capacity of staff, of services? Some say disorganized, some say exceptional. That's quite nice to hear as well. Exhausting, frustrating, unsuitable for a SEND child. I think that says. These word clouds are moving as I'm talking, so I'm trying to catch them as I can. Brilliant to see lots of participation. Inaccessible, there's a lack of communication, long waits, delays, no staff, different strands, frightening, which is quite sad and scary. Just give it another minute or so, if that's okay, before we move on.
And thank you for being so honest as well. We know there are lots of things that we need to work on, and yeah, it's good to kind of hear your thoughts.
Limited number of sessions, long wait times, rapid staff changes, underfunded. Brilliant. I think we've got a really good sense of your thoughts here. What we're hoping to do is for this presentation to be interactive. So we've got a few more of these slides as we talk through our presentation, and it might allow us to have a bit of time at the end. So you can either use a chat box to raise any questions that you want to ask us or want to discuss at the end of this session. So if we move on now to the next slide, and we're happy to provide this word cloud as well, if that's helpful, to thinking about kind of the scale of the challenge and the context. Yeah, brilliant, thank you. So everything that you have said and mentioned has been highlighted to us through various reports, anecdotal evidence, and things that we are seeing and hearing on a daily basis. So if we pull this slide together just to reflect on the scale of the challenge. So if we look back at kind of 2010 and the Marmot review that first took place, where he highlighted the fact that health inequalities are a real issue, and then we look at the 10 years on, February 2020, kind of 10 years on Marmot Review, what he's quite clearly articulated is that health inequalities have widened. We've got people living longer with more complex conditions, and things for those from poorer backgrounds, from ethnic minority backgrounds, are worse now than they were 10 years ago. Obviously, that was just before the pandemic hit, and that has just widened health inequalities, probably those that we already knew about before. And in amongst this time, we also had the launch of the long-term plan. And with the launch of the long-term plan, which was in January 2019, there was a clear commitment around children and young people's services, and the Children and Young People's Transformation Programme was kind of developed. And it's brilliant in articulating acute priorities around asthma, diabetes, mental health, well-being, and that sort of thing. But we think that there's more that needs to be done around community services. And now, kind of, looking at August 2022 is when the Children and Communities team has been kind of pulled together, and hopefully we've got this opportunity to really do something around children's community services specifically. But in between kind of the launch of the long-term plan and the kind of Marmot reviews and where we are now, the challenges that you've mentioned in the word cloud are very significant. So we've got real workforce issues. We've got issues around capacity, capability, around skills. We've got the cost of living crisis that's going on. We've got services which are funded in lots of different ways. So we've got local authority-led services and health-led services. We know that the pipeline for those that are qualified and experienced is not great, and there's more that needs to be done around that. And it's not all doom and gloom. There is some really good work going on, and Liv and I have been putting together a kind of a report which is in its kind of draft stages around where is there good practice, where is there things that are problems, barriers, challenges, but where are there also solutions. And hopefully as the presentation goes on, you'll hear more about the work that we do. But generally, if we move on to the next slide, in terms of where we sit within NHS England and where we are, as we mentioned, we are part of the community care services team, and the overall ambition is to support people to live independently in a place that they call home, whatever that might be. And the long-term plan helped us to raise that profile with investment around that. And I've mentioned some of the challenges before, and these span right across all ages. So things like backlogs in care, workforce pressures, shortages, retirements, and people going into different sectors like the private sector. Mentioned health inequalities and funding against rising costs as well. But there's also opportunities. So we are currently looking at what an all-age strategy could potentially look like. We're looking at how we work across our organisations, across government, with the voluntary community sector, with forums like yourselves, to gather intelligence and find the solutions that we need. So although we're here just specifically to talk about children, I think there's wider ambitions around we're taking an all-age approach to the work that we do. Moving on, passing on to Liv at this point.
Thanks, Nagina. So our team was set up last summer with a mission to optimise the support and provide a strong start to life to all children and young people who need access to children's community services. We know the remit of that is quite large, and again, during the Menti and in the chat box, if you've got any specific insights that you want to share or you want to have a separate conversation with us afterwards, we're more than happy to arrange that. Our current goal is to improve the outcomes for children and young people that need speech and language therapy and who have speech, language and communication needs through a programme which we're calling LSEC, which stands for Early Language Support for Every Child. And we'll talk through that a bit later, but we're working really closely in partnership with the Department for Education, looking at how can we be innovative and try and improve early intervention for children with speech, language and communication needs. The core work streams that we've got going forward, we think, and as Nagina mentioned, we're setting the direction of travel at the moment, and you know, again, it's helpful to get your views, is baselining current practice. So there's lots of regional variation that we know about. So we know that if you get you know, access to services in one part of the country, it might look very different to another person accessing the same service in a different part of the country. So we want to get a baseline for actually what's going on the ground. We want to build the evidence base for what works. So we want to look at actually where's there examples of innovation, and where are services that are delivering really good care for young people that need access to children's community services, and is this replicable in other areas. We want to develop specifications that different providers can then use based on those kind of examples of good practice, to say, actually, this is what we've seen works in different areas, and this is how you can improve your services. We want to improve and mainstream more granular data for children's community services. So at the moment, we are using a SITREP, which is a monthly data collection, to give us lots of our intel on the data for children's community services. But there's lots of work that we want to do to improve that further. And we want to improve our understanding of the workforce. As Nagina mentioned, we know that there are workforce shortages and pipeline issues. So part of what we want to do in our speech and language therapy project is look at actually who are other professionals that might be able to help support children with speech, language and communication needs, and what works. Our next discussion question, we want to put this to you. So what would make the biggest difference to you, your child and your family in the way that children's community services are currently run? If you have a specific, if you have a general statement, that's great. But if you are talking about your interactions with a specific service, it would also be good to know exactly which one you're talking about, and then we can make sure that we capture that. So I'm going to stop sharing this screen and put up the Menti screen.
There's also some questions from parents. Does this include social communication as part of this? I see you replied that speech, language and communication.
Yes, so that means it's speech, language and communication. And I think somebody else asked, I just quickly had a look, is this our personal experience? Yes, please, personal, professional, whatever you think is best. Really what we want to do is gain your insight into understanding what will work, and what will make life easier for yourselves, for the families that you know, the people that you work with, and anything really. So we've got things coming up. So we've got kind of OT, somebody said that they've had 3 referrals but no response. Joined up communication, I'm assuming that's across services. Effective communication, joined up thinking as a theme there. I think having the staff, communications coming up quite a lot. Holistic approach, brilliant, good to see. Early intervention, self-service, access when needed in a timely manner. It'd be interesting to see access where as well, and is it where you are? Is it schools? Is it communities? Understanding of older children, including teenagers, partnership with families is so important. Not being abandoned if you don't meet the criteria for the pathway. I agree. I think there needs to be a dialogue, an opportunity to ask questions and understand what is the best way forward. There's one here that's really interesting. With limited workforce on SALTs and OTs, should be trainers, should we can't quite read that, etc. Should be trainers and train the trainer model. Yes, I understand that. Yeah, shorter waiting times, support to pathways. Again, not enough staff is obviously a clear theme. Joining up to remove barriers, increase capacity, having options closer to home. Yes, greater trust, more consistency. Brilliant. We'll just give it another minute or so, Liv, just because I think there's quite a lot coming in. Help to navigate the system. Really good point. I think often parents can easily get lost in a system and not know that we're not one NHS body and there's lots of different organisations within it. Should look at parents as well as other professionals to support SALTs, etc. I agree. We were speaking to a speech and language therapist and she said up to 75-80% of the work is the parent or the carer that does at home with the child, not necessarily ourselves. But often it's difficult to work in partnership. Schools being more aware, yes. Train the trainer model, more timely mental health support. It's really useful, really good stuff coming up. And just to say that we will review this again, Liv and I, and get happy to come back to the group with kind of reflections or next steps. Genuine joint planning and commissioning. ICSs, schools and local authorities must plan and commission together. Really good point. Collaboration, holistic approach. Join up around education. It's really useful. Thank you.
It will be open for a little while in the background, but I'll go back to the slides.
Whilst Liv brings up the slide, we're just going to spend the next kind of 5 minutes or so looking at the data and what the data is telling us. Over to you, Liv.
Thank you. So just to give you a bit of background and context, at the start of the COVID pandemic, there was a situation report that was set up, which is a data collection mechanism. And this was started originally across all community services to assess the extent to which services have been impacted by pauses or delays as a result of the pandemic. So although this was across all community services, this started a monthly mandatory data collection across providers, including children's community services. So it's been really exciting to be able to have access to data on a national scale, but it has been set up relatively recently and there are caveats in the data. So we have spoken to clinicians actually this morning and they raised that there are some gaps. So we know that there are some gaps, but it's a good starting point because it will hopefully, it gives us a starting point to work on which we didn't have access to before. So the data basically relates to waiting lists of children and young people from referral to their first intervention. So just worth bearing in mind that anything following that first intervention won't be captured. Obviously the new referral will be, but that kind of starts again at the beginning of the process. So just a couple of caveats before I get into this. But our SITREP data is telling us that there are growing waiting lists for some services within children's community services. So in October 2020, that should be 2022, there were 206,504 children and young people waiting for their first appointment for children's community services following referral. The largest waiting lists in October 2022 were for speech and language therapy interventions with about 64,000 children and young people waiting, followed by appointments to see a consultant paediatrician with about 60,000 children waiting. And as you can see on the bar graph, those two services seem to be the services with the longest waiting lists by quite a long way. So for those joining on the phone, there's a bar graph which shows kind of in order of waiting list size. And then the third biggest waiting list is in occupational therapy, but that's got about 18,500 children waiting. So there's quite a big difference between speech and language therapy and those waiting for community paediatricians, and then the other services within children's community services. The SITREP data also shows some average median wait times across children and young people services, and this is across all weights. So this is the median waiting list as of October 2021. So those young people were still on the waiting lists in October 2021. This isn't a respective data collection. So for community paediatric services, the first intervention, the median wait was 16.5 weeks, with speech and language therapy 14 weeks and occupational therapy almost 13 weeks. But we do know that in some areas, children and young people are waiting for significantly longer than this. And we've had anecdotal evidence to show that there are specific services where children and young people are waiting for, months and years rather than weeks. So this data gives us a kind of starting point, but we know that there's more work to do. And the SITREP also shows some regional variation in terms of reasoning for services not being able to prevent reductions in waiting lists. So some key themes across most regions are workforce availability and an increase in demand and referrals. As I mentioned, you know, we want to kind of get your views. So it would be really good if we could hear from you about, you know, does our data reflect your experiences of accessing children's community services? And for you, hearing those kind of headlines, what are the biggest gaps in our current data?
I think Manrul picked up on within the conversation that it does, some of the data is tallying with what he's hearing and seeing on the ground and through the network and through the forums. But yes, anything that else that you can add to that, that'd be really useful. Thank you.
Yeah, I mean, there is a question about mental health not being included as part of the community services, but I think you've said that other teams are focusing on that.
Yeah, so we did have one service line that looked at mental health and well-being, and that was taken out because I think it was accounted for somewhere else. But Liv and I can take that away and have a look and see what the data is telling us around that.
And I'm just kind of picking up, Jilly, I think you said this is part of the issue, that mental health should be part of community services, and everything being separate is part of the problem. Again, it's really useful to hear your kind of feedback, and we can take it back to the data and analytics team. So thank you.
There's also a question saying, where is the ASD pathway in this data?
So the ASD pathway is separate. So at the moment, as I mentioned, the SITREP is just a snapshot really of first interventions with a community paediatrician. So data on ASD pathways would be, we don't have access to that information at the moment, because following that first initial appointment with a community paediatrician, that child or young person would then go onto a separate waiting list for ASD. So we don't unfortunately have access to that.
There's a link here, so we don't have access to it in terms of our team isn't kind of responsible for it. I'm just going to see if I can drop you a link to something that might be useful. It might not completely entirely answer your question, but I'll pop it in anyway. So just picking up some of the things in the conversation. People are saying we feel like the waiting lists are longer. So the question is, does the data reflect your experience of accessing children's community services? And there's a couple of people that have said yes for SALT, and I would expect mental health to be high. SALT, yes, a huge need. Waits in Cheshire East are longer, and often you wait on one list and then another, and yes, yeah. Mental health has come up again. Staff shortages is a big issue. It depends on the area and the commissioned offer. CAMS waits, access to mental health support. Services are already stretched. This data doesn't necessarily tell the story of families who don't meet a high threshold. Finite services. There's clearly a theme around mental health that's developing here as well. Just give it another half a minute or so, and then we'll move on. And I mean, the other clear theme is staff turnover and workforce. Somebody's just put qualitative data, what impact are these waits having, and what interventions and support is available. Really valid point, and something that we are picking up. So Lorraine Mulroney, who hopefully some of you have met, organised deep dives into Yorkshire and the Midlands, and we've got some anecdotal kind of quotes and kind of information and life stories, if you like, but more needs to be done to align that with the data that we've just shown. Another really valid point, doesn't reflect the areas are competing for staff. We border lots of areas and lose staff to higher paying neighbours. Yeah, that's something we've come across quite a few times. And also the fact that if you look at speech and language therapy, the bandings can be so different. So you could be an assault at band 6, 7, or an 8A. Again, somebody saying that waiting lists seem to be getting longer from what families tell us. It doesn't reflect how long families are able to access services. Valid point, data seems to allow commissioners to think it's working, not qualitative info about whether it works and what the outcomes are. Transition is also mentioned. Okay, we'll move on, but in the background you can still add to that, and then we can pick up after this session. Thank you. So from what we've discussed and what we've seen, and hopefully how you've participated, one of the programs of work that we are hopefully going to be launching soon, although this is not public information, is a joint initiative between the Department for Education and us at NHS England, where we are exploring a proposal to co-fund 9 Pathfinder sites right across the country, focused on specialist support for children kind of in early year settings, community settings, and in primary schools, to identify and screen those that might need speech, language and communication needs earlier, and to put initiatives in place, support services, triage, signposting and things like that before needs become acute, and also potentially identify those that might need a bit of extra support. I know that I don't need to tell you this because you live and breathe this, and you know this, but we know that there is about 1.7 million people, children, across the country that have probably got some kind of speech and language therapy need. We know that about 70%, just over 70% of those that are in the criminal justice system, youth offending system, have got some kind of unmet speech and language therapy need. And we also know that about 60% of those from ethnic minority deprived backgrounds are likely to have some kind of speech and language therapy need. If these individuals' needs are met, their kind of life experiences and trajectories to, their kind of life outcomes would be very different. And the purpose of this program of work is to really think about that and focus on that. So it's about trying to obviously reduce the demand on services, but provide support in the community where people are. And I've just noticed a spelling mistake there, my bad. Second bullet point is supposed to say reduced waiting list. Sorry about that. And I've seen this slide so many times. And
you know where the 9 sites will be?
No, not yet. No. So like I said, this is work that we are just developing, but we just felt like it would be useful to share this information with you now so that you're aware. There's a whole bit of work that needs to be done around kind of funding, confirmation, site selection, criteria that sits behind that, what that looks like. And we'd love to come back to the group when we've got more information. But at the moment, the purpose of this is just to inform you that this is going on. And if the group is interested, we'd be happy to come back and tell you more. The outcomes of some of this work are to test the idea of having support worker roles, those that perhaps are entry-level NHS bands that might not have qualifications but have the aspirations to think about being qualified speech and language therapists or support assistants in the future. It's about testing whether we can triage people early within the community in a setting that they are familiar with, and it's about providing support through group group support, through signposting, through information, through apps and things like that. This is very, very new information, and like I said, it's not public at the moment, but we just want to let you know that this is something that we are thinking about, and we will begin to involve more people once we have things confirmed.
There's a couple of questions. Will ICANN be involved?
Yep. So we're happy to involve as many stakeholders in the development of this, but we are at the very, very early stages at the moment, but happy to pick up conversations.
But also we've been in discussion specifically with the charity ICANN recently about this. So in answer to your question, yeah, we're making, they're key stakeholders, and we're making sure that we work together.
Somebody asked about what about social emotional support in mainstream secondary schools?
So the purpose of this program of work is early years and settings, but this is one element of something that we are working with, and I think there's a whole host of other things that are happening across NHS England as well as DFE around that. And I think that when your face-to-face conference is on the 28th of February, we might be able to say a little bit more about the other elements of this. And like I said, we're happy to keep in contact and keep you updated with some of the other programs of work that are in development at NHS England at the moment as well. So just another discussion point. So if your child uses speech and language therapy services, or you know of somebody that is accessing speech and language therapy services, is there any insights that you can offer around the benefits of early intervention? And again, as part of our kind of work in developing the proposals for getting the funding confirmed for doing this, as you know, there's a whole kind of cost-effective economic argument that we need to have. So if there is anything that you can usefully add to that, that'd be really helpful. Thank you. And also, if you've got any kind of links, you know, websites, details of anything that's happening anywhere where we can find out more, that'd be really helpful as well. Hopefully people are having a think, and we're going to get lots of ideas here. I think the idea of being able to dip in and out once a child has been signed off is really useful and helpful. I mean, not speech and language therapy, but my middle child, who's 5 now, had eczema, and when we were signed off, we still had the opportunity to dip in and out, and I accessed the service about 3 times, but it was really helpful not to go through the referral process to access the needs. So that's definitely something we're thinking about. Impact on emotional well-being, yes. There's a really valid point here. Early intervention would be amazing, but it simply doesn't happen without informed parents knowing how to access it. That's very true, particularly in areas of high deprivation where there's you know, families facing a number of challenges. And I think that whatever we want to do, is that there's an opportunity to really use a community-based community development approach to doing what we do. See, it's this kind of information here that's really useful. Liv, just go up a little bit. There's one where somebody's mentioned it took 3 years to gain speech and language support for my non-verbal son. My other son, also non-verbal, has SALT from 6 months, and a difference it has made in progress is substantial. Now I have to keep refusing to be discharged. I'm not surprised.
I think the responses are slowing down a little bit, but our next slide is also, there's just one more that's come through. It's essential to fully involve families and help them understand the system so they can complement any SALT in the home effectively. And I think that's really important, and also what we're hearing from clinicians too. The next question that we've got is another Menti. So instead of switching back and forth, I'm just going to go on to the next slide. But if there's any other things that you want us to add, if you put them in the chat box, we can move them across. Lovely. So the final question is how can we support you and amplify your network's voices at a national level? You know, we've mentioned a couple of times that we're, you know, a new team, and we have spoken to you about kind of our early thoughts about our project for speech and language therapy. So we're quite keen to be quite involved with you guys and make sure that we're helping you as well as a new team. So if you do have any thoughts, please do let us know.
Happy to work in partnership with you guys. Thank you for allowing us this time. Co-production, working directly with forums. Like I said, we're happy to come back with a bit more, you know, of a confirmed idea of what it is that we can do and what we can say, which hopefully will be in a few weeks. Continue to share with us and seek input. Thank you. You said today has been helpful. Thank you for joining. Definitely have a meeting with the parent child forums, I think that is. Parent care forum, sorry. Ensuring ICBs are aware of working with us, communication. We would love to work closer, as at the moment our rising concerns end with service providers and commissioners. I think that there's clearly a movement that's needed. The urgency around this agenda is needed, and communication both kind of with services, but just in terms of more widely awareness of seeking the support that's needed.
There's a kind of a question in the chat. What happens with children when they reach age 16, when they're too old for children's services but too young for adult services?
So the Children and Young People's Transformation Board is looking at transition, and actually it depends on the child's situation, because some services run to 18, others to 24. I can't fully answer that particular question, but I think that that's something that we can take back. But just to say, transition is one of the priorities of the Children and Young People's Transformation Programme.
And I think there's a message because you're struggling with Menti. We're keen to link up in Gloucestershire as we're currently working with commissioners on speech and language.
Yeah.
And there's in your comments around making sure the ICSs and ICBs understand co-production and the value of working directly with community representatives.
Yeah.
But I think that's highlighted in the Menti as well.
Yeah. And also it would be good to know kind of, like Helen, you put that you're struggling with Menti, but that's fine. We can add that comment in, that, what capacity are you working with them and how far have you got and what is it that we can do to support, would be really useful to understand as well. And somebody's put here, we need to raise the agenda with health and wellbeing boards as they don't seem to realise this is under their remit. I love that. Forums are very solution focused and have a wealth of intelligence to support us. So yes, please do help us. Make sure that it makes a difference. 100% agree. And the fact that time is very precious. Yes, I agree. It's hard enough to be a parent, and then to advocate for and voice for needs is an extra kind of pressure and value. I think that's probably everything for now, Liv. Is that right? So you might be pleased to know that our presentation has come to an end. We've got around about 10 minutes. Cindy, Helen, I don't know how best you want to use this time. So we're happy to have a follow-up conversation. We're happy to review the slides and the comments and the word clouds and things like that, and have a conversation around what next. But I don't know if anybody's got any quick reflections or anything they want to share.
It says, will you be sharing the Menti feedback to all of the participants? Yes.
Yep, happy to share that. I think what we'll do is we'll probably have a conversation with Manrunal, yourself and others around what, your reflections, ours, and then think about, well, what we are going to actually do about all this information and insight that we've gathered today, and what the next steps are. And if we are to have some kind of mini stakeholder session, we'd like to come back with you with when that might be and what we can discuss at that point.
Somebody says they have good examples, or they have examples of good practice. How would you want us to share this?
So through yourselves, or Liv's put her email on this slide.
Yeah, so can I possibly just jump in here and say, yes, if you have good examples, if you have further things that you want to share, thank you. You can send it to Liv directly. Her email is on this slide, but it's also really helpful if you could CC in your regional NNPCF steering group member, because then obviously that keeps us in the loop as well. And Nagina and Liv, if you would like to come back and perhaps ask us to run some focus groups for you, but test some of the implementation and the rollout, then we are very, very happy to organise that for you. We can either do that in a region-specific way or national groups as well. So this has been you can see from the reaction that there's been a lot of interest in what you're doing, which is good. And maybe we're really happy to partner with you over the next coming months as you start to shape that up a little bit more and start thinking a little bit about how you implement it, as to co-producing the next steps with you as well. So please, you know where we are, and really happy to partner with you on that.
Brilliant. Thank you so much. And just to say to the group that, we really value your time. Thank you for being here and for listening. This is our attempt at doing something that we know has led to a lot of frustration because we're talking about children and we're talking about people's lives and the trajectories for the rest of their lives as well. Like we said, this is a newly formed team at NHS England. We started in August and we're really keen and passionate on making a difference. I'm here until March. I'm covering a maternity cover, and then we've got a lovely person called Faye who will be joining us, and we will be kind of working throughout March together, and we're likely to come back to you around about then, but we'll give you the kind of a bit of a kind of summary of what we've heard, what we've seen, and what the next steps are in the next couple of weeks. Thank you so much.
That's great. Thank you. Can I just say thank you to Nagina and to Olivia, and what we'll do is that summary, when you pass it on to us, Nagina, we'll post that onto our website so all of our forums then can see that. And just a suggestion, people will watch this back. The session is recorded and people will watch this back. If you would like feedback from the people who weren't physically able to be here today, then if you leave the Menti poll open for a week or two, then you'll capture some feedback from people who will be watching it back recorded as well.
Brilliant. Thank you. We'll do that.
Thanks so much.
Thank you all. Bye.